Hi, today is International Oral and Maxillofacial Day. So, for today, we have an interview with Dr. Shakti Singh Deora. He's someone who, after completing his BDS and MDS in oral and maxillofacial surgery, did not stop there. He went on to do fellowships in oncosurgery. He has attachments with various universities across various countries, from the USA, Taiwan, and Germany as well. His foundation runs a lot of programs, both preventive and on the treatment aspect when it comes to oncosurgery. His foundation carries out various programs both for the prevention as well as for the treatment of oral cancer. And for that, he has involved a large number of dentists across India. So, in today's interview, we are going to discuss what his foundation is doing currently and what are their future plans. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Shakti Deora. It's amazing to
Hello.
finally have you on our channel.
Thank you
You
so much
have
for your invitation.
been an inspiration to me, and today is the Oral and Maxillofacial Surgeons Day. Okay, so I thought it would be appropriate to get you on board.
Thank you.
One thing, we have a lot of young dentists, okay, and many of them think that oral and maxillofacial surgeon is all about money. You do it so that you can earn more, and it's like the top branch, okay. But seeing you, I realized there's a lot of contribution which has to be made. So I would like you to tell me how can you contribute as an oral and maxillofacial surgeon, and how have you done it for the society?
Okay, so before, thank you for your invite me on this show, on this talk show, and thank you for your wishes on International Oral Maxillofacial Day. So, I being maxillofacial surgeon, I'm happy to share my views on what does a maxillofacial surgeon, how do they contribute to the society. Now, I tell you, the maxillofacial surgeons, basically, they are the surgeons who deal with the pathologies, the diseases, abnormalities of jaws, mouth, and neck region. So now, maxillofacial surgeons, they contribute to society or in two ways. There are two important aspects which are related to the maxillofacial surgeons. One is the Smile Print project, wherein there's a cleft lip, cleft palate patients are being treated by these maxillofacial surgeons at free of cost to these patients, to the patients. Second aspect is the oncology or the cancer. Now, as we all know that the cancer is one of the pandemic which is we are going to face in coming years, and maxillofacial surgeon is a very important one of the commando force in combating against this cancer when it comes to the prevention, early detection, treatment, and rehabilitation. So, being a maxillofacial surgeon, I'm proud to be a maxillofacial surgeon.
So, could you tell me a little more about the oncology part of it and how are you contributing in that aspect?
Okay, so basically, now when it comes to the oral cancer, maxillofacial surgeon is completely involved in the prevention aspect. The first thing is the prevention aspect because these oral cancers are preventable cancers. The second is early detection. Now, my boss always used to say, we cannot become God to cure this stage, all stage for patients. But yes, how we can make a difference is we can detect these patients on early stage, treat them aptly, and give them a good quality of life. Third aspect is the treatment aspect. As I said, the maxillofacial surgeons are involved in the surgical aspect of these cancer surgeries. More importantly, the maxillofacial surgeons have got a very good orientation of anatomic orientation of these facial structures, so that helps when we are doing the reconstruction aspect of post-cancer ablative surgery. So any patient who is undergoing cancer surgery, we need to reconstruct the jaws, the cheek, mucosa, tongue, lip, everything. And that is best done by maxillofacial surgery. Then comes the follow-up or the rehabilitation aspect. Now, as we all know that the quality of life is one of the important aspect we see with a patient point of view. After the surgery is being done, the patient is disease free now, but he wants to have teeth, he wants to have chew something. He cannot be on liquid diet throughout his life. So that is where important aspect is the implantology comes into a role, and that plays a very important role in giving rehabilitation to these patients to enhance their quality of life.
So I know that you're working on a foundation which does all this. Could you tell me a little more about the entire foundation and how the genesis, how did it start?
Yeah. So the foundation is basically the Asian Head Neck Cancer Foundation. It is one of the unique foundation which is exclusively working on head neck cancers beyond the prevention aspect, early detection aspects, the treatment aspect, and the follow up aspects. Now, the idea behind this starting this fellowship is there are two important people who in my life has made me think in this way. One is my father, who is a ex-serviceman, retired from defense, Indian Defense Services. He always used to say, "You should be contributing towards society each and every day." ऐसा नहीं होना चाहिए कि हम जब 60 साल के हो जाएंगे उसके बाद में समाज के लिए कुछ करेंगे. No, we need to contribute the day we become, कि अब हमारी इतनी हम इतने कैपेबल हो गए हैं कि we should contribute something to society. The same day your social commitment should start. The second is my guru, my mentor, Dr. S.V. Kumarswamy, who is my guide and from whom I have learned the, the oncology part of, or from where I have learned being into, from maxillofacial, evolve into the maxillofacial oncosurgeon. So these two people are very important people who have changed my thought process that we should be contributing towards society. And Dr. S.V. Kumarswamy is the patron of this NGO. And my father, Captain Ratan Singh Deora, is the founder and president of this NGO. And that is how then bits and, slowly and slowly people have gathered together and we had made this foundation. We established this foundation registered in Rajasthan, and we have been extensively working on this head neck cancers.
So what all things are under the foundation? What all are you doing right now and what all are you trying to do?
Okay, so basically we have few programs like the one of the few important programs I can share with you is one of the program is the TOS program, that is Tobacco School Sensitization Program. Now, when we talk about the tobacco cessation, when we talk about the cancer, the first important thing which stuck is we should prevent this cancer. Now, how does this cancer, oral cancer, happens? The majority of oral cancer are contributed by use of tobacco, and we all know, even a even the masses know that tobacco causes cancer. Even a packet of tobacco, they clearly writes that this causes cancer. But we need to make people aware, stress more that this tobacco is not good for your health. And it's not about an individual health, but it's all about the health of the family. So we are basically working towards tobacco cessation. Now, when we talk about tobacco cessation, the tobacco cessation is in two aspects. Number one is how many people are adding on to the use of tobacco. Like this tobacco habit, usually it starts from the school or the college age. The people in the peer pressure, usually the tobacco habit is started off. And secondly, those who are already using this habit, we need to break that habit. So in these two aspects, what we have felt it is breaking the habit of already using the tobacco, the ratio is very low and it is very difficult. Once those who are habituated to tobacco, they usually do not, they have a lot of resistance to break that habit. But what we do is we train the people in the school itself from the 8th standard to 12th standard. We make them aware about the ill effects of tobacco, how it can cause bad effects on your health, and not only on oral health, but as well as on the general health also. So what had happened is, the important finding what we have got it is, the people whom we have trained it in school, now they are helping us in quitting the tobacco of their family members also.
Great.
So TOS program is wherein we, when I say we means, being from the dental fraternity, we usually takes the lectures, assembly lectures on oral health and the ill effects of tobacco. So we have a huge network of dentists, maxillofacial surgeons who are involved, actively participating in this program and making a difference into this society. The second important or well-running program is the Ecan Clinics. Now, what is this Ecan Clinic? So E stands for early detection of cancer, E for empowerment of dental professional, and E stands for E health services or digital health services. Now, the idea behind starting this Ecan clinic, right now we have more than 50 Ecan clinics running in parts of Rajasthan. So, what does this Ecan clinic do? We have an association with the dental clinics in the peripheries, or I can say in the in the rural areas of our rural areas of Rajasthan. So any person who is having a clinic, any person can go to these clinics and get their oral cancer screening at free of cost.
Good.
All these dental surgeons are being trained by our foundation, and they have been the certification is given by the Gujarat University, that they are, our DCI definitely it gives us the rights to do the screening, but we still have to empower these dental professionals, give them some more added certificate, that so that they are involved in this oral cancer screening and prevention aspect also. So all these people at Ecan Clinics, they are doing the cancer screening at free of cost. Any person can move into their clinic, get them registered, and get their oral cancer screening done. Second is, every month there is a camp to this Ecan Clinics. So every month there's a camp is conducted in and around the periphery of his clinic, so that we give a platform for a dental surgeon to develop. There are more number of people walking into his clinic with a fear of cancer, getting themselves checked, and in turn we are helping a dentist also in increasing the footfalls to his clinic. At the same time, the patients are getting benefited, that they are screened for cancer at zero cost or
So it's
free
an
of cost.
absolute win-win, basically.
Yeah. And a dentist is being paid by the NGO for his services, because I do not want any dentist to work for free. Yes, we pay a subsidized amount, but we do pay to the dentist, that if he has done the 50 cancer screenings, we are making a payment of XYZ to the dental surgeon. So
Very good.
now we all are in a win-win situation. As you said, a dentist has been benefited, the patients are benefited, and being a social worker, our NGO is also benefited in our work. So this is what the basic idea about Ecan Clinics, and we are also empowering all these Ecan Clinics are visited by maxillofacial surgeon.
Good.
All
Really
these
good.
clinics are visited every month by maxillofacial surgeon. So if they have any doubt, if they have biopsies is to be taken, or if they have to consult a patient, the maxillofacial surgeon goes to their clinic, he counsels a patient, sorry, he counsels a patient, and in case if the patient requires the further workup, then they are being referred to secondary diagnostic centers. That is in Rajasthan right now, the Sumerpur Bhagwan Mahavir Hospital, a place where we do the CT scans and other things. If any patient requires treatment, our foundation is also giving the treatment at a very subsidized rate at this at the Bhagwan Mahavir Hospital. So that is how the And after the treatment is done, they will be taking the follow from these Ecan Clinics. So if they have any dental issues, the dentist involved in the diagnosis will be taking care of all his dental issues. So that is how our basic idea about the Ecan Clinic is working. And we are planning to expand to another 500 clinics and probably by this year end, because we have a
Very good.
huge response from the dental surgeons. And one more program is, as you must be aware of it, it is education for cancer. Now, why this education for cancer? This Educan has been started 1 year back, keeping in mind that every dental surgeon should at least understand his responsibilities, then, or I can say professional as well as social responsibilities to actively involved in oral cancer prevention and diagnosis. So what we have done is we had planned out a program. It's a 3 module program followed by an exam. Because of the COVID, we have still kept this program as an online program. This certification of this program is endorsed by the Gujarat University, and there is a faculty, there's a faculty, national faculty of 15 to 16 people across the country. So everyone across the country, and majority 90% of the faculty involved in educan is from the maxillofacial surgery background. So these are the people who are taking this all these modules, training these dental surgeons, and we are also being connected to it. If they have any doubt, anytime, if they're a patient, if they want any guidance, we are 24 into 7 available, guiding these dental surgeons to properly guide the patient for the right treatment in whichever place they are. Maybe they are in West Bengal, if they are in Bangalore, or they are in Gujarat. So that is how the Educan is one of the program wherein we are training the dental professionals. We are empowering the dental professionals to actively participate in this tobacco cessation, early detection, and follow-up of these cancer patients. So these are our unique programs the Asian Head and Neck Cancer Foundation is running, and these are very well appreciated even by the Gujarat government. And recently we had an MOU with Gujarat, the government of Gujarat, for our contribution towards the society.
Really great. So these are the three things you are working on. Okay. But
Yeah,
I know you personally, so I know always you have something up your sleeve. Is there
yeah, yeah.
something else you're trying to start now? Before you listen to the answer to that question, if you're liking this interview, please do not forget to hit the like button below.
Yeah, so this maxillofacial day, we had planned to actually uh, launch a nationwide campaign on self cancer check. So the idea behind this campaign is, as I said, oral cancer is a visible cancer. Oral cancer is a visible cancer. A person can do his self oral examination. There are list of symptoms. There are list of symptoms that if you have these kind of symptoms, you need to consult your nearby dental surgeon, maxillofacial surgeon, or an oncosurgeon. So we had made awareness video wherein we are training them how to examine them, and we have made a chart that if you have this symptom, do let us know. And then we are going to connect them digitally in whichever part of the country they are. We are going to refer them, or we are going to guide them to the nearest dental surgeon for their examination. That will be supervised by a maxillofacial surgeon or a oncosurgeon. And once it is done, and if the patient find it to be suspicious, definitely we are going to guide the patient further, so that if he is on a stage 1, he should be treated on stage 1 to give them a good quality of life, as well as prognosis of the stage 1 disease is far better than the stage 4 disease. So that is how we have drawn this nationwide campaign. In this campaign, we are going to develop a network with a maxillofacial surgeon across the country, also with the dental surgeons across the country, so that it will be helping us in guiding the patient to the right doctor or surgeon for the further treatment. So this is what the idea behind launching this campaign on this International Oral and Maxillofacial Day by name Self Cancer Check.
Really great. It's a really great idea. The best thing I liked about all your programs, okay, they're not just focused on only the patient or only the dentist. It is always mutually beneficial that dentists can help their patients and the dentists themselves can provide treatments which they were not providing previously in their clinics. So it
Correct.
always is beneficial to the patient, to the dentist, and to the society as a whole. So that is the best thing I've liked about all the programs you have
Thank
been
you.
conducting till now. Okay.
Yeah, thank you.
But one thing I wanted to ask you, you have already so many programs, and I keep on seeing you innovating to add one after the other. Okay. You don't seem to stop. So, what
Yeah,
inspires you? You've told me about your father already. Other than
yeah.
that, what inspires you to keep on giving back and keep on growing us?
See, basically, if I say my background, I come from a very middle class background. Being becoming a doctor was, a very far sighted dream कि मेरा बच्चा भी कभी डॉक्टर बन सकता है. So God has helped me in reaching to this position. So being connected to the roots, I still go visit my village. I spend time with the people in the rural areas. And I think that is the connection with the people in my village is one of the inspiration that always, drives me that I should be doing something for these people or the people related to these people. And as I said, the cancer is pandemic. It is going to become a pandemic in coming time. So I always thought of, the thought goes on my mind that I should be contributing because God has helped me to reach this position. Now it is my responsibility, I feel is my responsibility to deliver and make these people aware, in especially in the field of cancer. That is what I can do it. So I think that is being connected to roots is one of the driving force to always think, come up with some ideas and execute those ideas.
It was a very nice session with you. I'm sure a lot of young dentists would be inspired to not just grow, but to even give it back to the society. Thank you, Dr. Shakti, for taking time and being with us today.
Thank you, Dr. Satish, for your invitation. Thank you.
Thank you.